Hello everyone, we are group 7 and today we will be talking about traumatic brain injury. Traumatic brain injury is defined as an alteration in brain function or other evidence of brain pathology caused by an external force. Traumatic brain injury can occur for a number of reasons, but most commonly happens because of close contact sports such as injuries from boxing or football, motor vehicle accidents with head trauma, falls, which you normally see in children and the elderly, strokes, which occur because of a reduced or interrupted blood supply to the brain, penetrating injuries such as bullets, shrapnel, or a piece of the skull penetrating the brain, and physical abuse. Today, as far as TBIs are concerned, we will be focusing on the pathophysiology of concussions. Let's begin with the different severity levels. There are 3 classifications of concussion. The first is mild traumatic brain injury or mild concussion. With these concussions, there may be no loss of consciousness, or if there is, it may last less than 30 minutes. The second is moderate traumatic brain injury or moderate concussion. This is going to be a loss of consciousness lasting more than 30 minutes or up to 6 hours. The last is severe traumatic brain injury or severe concussion, and this is a loss of consciousness lasting more than 6 hours. When talking about concussion, there are 2 main types of injuries, coup, contra coup, and torque injuries. Here I'm going to be using boxing as an example. If someone gets hit to the front of the head, that first hit causes a contusion to the point of impact, or the front of the brain. This is what we call a coup injury. This initial hit will cause the brain to continue to move till it is stopped by an impact with the back of the skull, resulting in a contusion to the posterior portion of the brain. This is called a contra coup injury. In another scenario, the boxer is struck with a right or a left hook. This causes the neck to twist and also causes damage to the brainstem, in particular the reticular formation, which is a bundle of nerves located in the brainstem. These nerves are responsible for your level of consciousness. A mild concussion happens normally because of blunt force trauma to the head and results in a diffuse brain injury. This is an injury that isn't localized to a specific area but is spread to a large portion of the brain. When this diffuse brain injury happens, damage is done on a microscopic level to the neuron, specifically to the long axon of the neuron. This allows potassium ions to leak out of the neuron and sodium and calcium to leak into the neuron. This electrolyte imbalance causes depolarization, which leads to an action potential. Now, millions of neurons are depolarized from the damage from this concussion. Because of this, there's a release of glutamate. Glutamate is an excitatory transmitter that is released by nerve cells in the brain. This release of glutamate causes mass amounts of action potentials and an increase in metabolic activity of the brain, and in turn, this increases the demand for blood in the brain. This creates a huge problem for the brain, because for reasons not yet known, after a concussion the body decreases the supply of blood to the brain. An increase in demand and a decrease of supply leaves the neurons starved for energy. This glucose starvation can last for a few hours or up to a few days. Hypoglycemia in the brain can lead to confusion, seizures, and loss of consciousness. Alright, it's time for our first quiz. A 2-year-old toddler patient was rushed to the ER after a bookshelf fell on top of him in his home. The paramedic reported that the boy was unconscious when they arrived at scene. By the time they got to the hospital, he had been unconscious for a total of 60 minutes. The child did not appear to have any other injuries besides the blow to the head from hitting the floor. The nurse recognizes that he has suffered from a blank concussion. Is it A, mild, B, moderate, or C, severe? I'll give you a couple seconds to think about this. Alright, the answer should be B, moderate. As I stated earlier, a moderate traumatic brain injury or moderate concussion is any loss of consciousness lasting more than 30 minutes or up to 6 hours. Putting him at 60 minutes would make him a moderate concussion.
Moving on, we're going to talk about the TBI clinical manifestations. So the physical clinical manifestations for traumatic brain injury include fixed dilated pupils, contralateral hemiparesis, this is going to be the weakness on one side of the body, paraorbital ecchymosis, this is commonly referred to as raccoon eyes, as there is a discoloration around the eyes. Battle sign, this is a hematoma behind the ear. Hemotympanium, this is the bleeding in the tympanic cavity. Autouria or rhinorrhea, this is going to be the bloody discharge mixed with cerebrospinal fluid coming out of either the ear or the nose. Cerebral contusion, if you remember, that is a bruise of the brain tissue. Vomiting, seizures, Cushing ulcer, weakness or numbness in the fingers and toes, which is referred to as paresthesia. There is an increased risk of meningitis, and you can also have retinal hemorrhages. So moving on, we have the cognitive symptoms of TBI. This is going to include your headache, amnesia, which is going to be your post-traumatic memory loss. The patient will also be confused or dazed. They may also manifest an altered mental state. They will have slurred speech, mood changes. The patient may be anxious, depressed, and they may have a sleep disorder. And in severe cases, the patient may go into a post-traumatic coma. And lastly, some will experience post-traumatic stress. Next, we're going to be talking about assessments for a concussion. First, we want to ask the patient if they're experiencing any sort of pain. It is also essential to ask the patient what makes the pain worse, what makes the pain better. Speech and hearing assessments are used to examine the impact of a specific part of the brain. Comprehensive assessments will assess the patient's amnesia or memory loss, if you recall. Sensory loss will assess for the patient's paresthesia or numbness, as well as visual disturbances, and then assess the patient's motor movements. Do they present with weakness or a loss of balance and coordination? Here we have an application question. Following an aggressive tackle during a football game, a 14-year-old patient presents with dilated pupils, headache, vomiting, and ecchymosis. The young man was unable to recall his name and age. Physicians concluded that the teen has TBI. What does the sign ecchymosis refer to? So I'm going to give you a few seconds to think about that. A, hematoma behind the ear. This is actually going to be the battle sign. B, bloody discharge with cerebrospinal fluid. This is either going to be autouria or rhinorrhea, whether depending on if it's coming out of your ears or your nose. C, raccoon eyes. Remember, these are the dark circles around your eyes, which is ecchymosis. So C, raccoon eyes, is going to be your answer.
Traumatic brain injuries are very serious and need to be diagnosed quickly. Patient history, physical examination, assessment, and imaging all contribute to the diagnosis. Computerized tomography CT scan. CT scans are typically the first test performed immediately after a suspected traumatic head injury. CT scans provide fast and highly effective results detecting fractures, edema, which is swelling of the brain, hematomas, which is blood clots, and hemorrhage, which is bleeding in or surrounding the brain. CT scans use a series of X-rays and a computer to generate a detailed image of the body, and in this case, the brain, from different angles. CT scans are used to detect life-threatening problems and determine if surgery is needed. In some cases, radiographs are also used in addition to CT scans, but they are not taken in absence of. Magnetic resonance imaging. MRI scans are performed once the patient is stable. MRI scans create detailed images of the brain and the body with the use of a magnetic field and radio waves. MRI scans detect signs of injury to the brain such as cerebral microbleeds, bruising to the brain, and scarring to the brain. MRI scans sometimes detect injuries that CT scans do not. Functional MRIs, also known as fMRIs, are a special type of MRI that creates images of brain activity and blood flow to the brain. fMRIs are used to assess damage to the brain as a result of a head injury. Intracranial pressure monitor. ICP monitoring is a test that is used to detect tissue swelling as a result of a TBI. Intracranial pressure is tested by inserting a probe through the skull. Increased ICP can cause further damage to the brain, so it's important to catch. Diagnosing a concussion. There's not one single way to diagnose a concussion. Multiple factors have to be taken into consideration when diagnosing a concussion. Things like patient history, evaluation of their signs and symptoms, physical examination, a neurological exam, cognitive testing, and imaging all contribute to the diagnosis. Neurological exams evaluate reflexes, coordination, balance, strength, sensation, hearing, and vision. Cognitive tests evaluate memory and concentration. All of these things can be affected when someone has a concussion. CT and MRI scans do not always detect concussions, but they're often used to determine if the concussion has caused further injury such as swelling or bleeding in the skull. Labs. Blood tests can test for protein biomarkers when a suspected brain injury goes undetected on imaging scans. Glial fibrillary acidic protein and ubiquitin C-terminal hydrolase L1 are all biomarkers for TBI and can detect brain injuries that go undetected in CT and MRI scans. This is not an official diagnosis. A nurse is treating a 73-year-old woman with a closed head injury after a fall down her stairs. How are traumatic brain injuries diagnosed? A. A physical examination. B. Imaging. C. A neurological exam. D. Patient history. Or E. All of the above. We know that all of these contribute to the diagnosis of a concussion, so the answer is E. All of the above.
In any level of traumatic brain injury, the common goal as far as treatment is to stabilize the patient and prevent any further damages. With mild injuries, after evaluation, doctors normally emphasize rest as being a key component for the recovery process. Both physical and cognitive rest is very important because this will allow time for the brain to heal. For pain management and inflammation, normally just over-the-counter medication is recommended. Doctors will also instruct the patients or the patient's family members to closely monitor for any new or worsening symptoms for the next few days. Doctors may also recommend moderate neck exercises once the patient feels a little better to increase blood flow to the brain, and this will also help with the recovery process. As far as recovery time, each patient varies, but typically it's within 7 to 10 days. Moderate to severe injuries are commonly seen in emergency situations and may involve a more extensive approach. Once the patient is stabilized, a combination of surgery and medication may be necessary to prevent further damage to the brain. Surgery is usually required for injuries resulting in a hematoma in the brain, pressure buildup in the skull, a skull fracture, or hemorrhaging in the brain. In some cases, patients sustain permanent damages and will require long-term rehabilitation treatments. As far as the recovery time, it is indefinite and depends on the severity of the injury. For treatment with medication, commonly prescribed medications include ibuprofen for pain and inflammation, anti-anxiety medication to lessen feelings of nervousness, anticoagulants to prevent blood clots, anticonvulsants to prevent seizures, antidepressants to treat symptoms of depression, muscle relaxants to reduce muscle spasms, stimulants to increase alertness and attention, diuretics to reduce fluid in tissues, and coma-inducing drugs. This will reduce the brain's need for oxygen to function, which actually benefits the brain in the healing process. Depending on the severity of the injury, some patients may require a select form or a combination of rehabilitation therapies, which include physical therapy to regain mobility, regain balance, and/or relearn basic movement skills like walking. Occupational therapy to help relearn everyday tasks such as getting dressed and bathing. Speech therapy to help relearn communication skills. Visits with the neuropsychologist to assess cognitive impairment and help develop coping strategies. Neuropsychologists also provide psychotherapy for emotional and psychological well being. Vocational counseling to help assess the ability to return to work and provide resources for addressing common challenges in the workplace. Psychiatrists to help manage mental health issues such as depression, anxiety, and PTSD. As a nurse, it is important to inform and educate the patient and the patient's family members with treatment plans, expectations, and warning signs. Patients need to get adequate sleep, plenty of rest, and maintain a well-balanced, nutritious diet. Rest and nutrition is important during the healing process of the brain. Alcohol and caffeine should be avoided to prevent headaches and overstimulating the brain, which may slow down the healing. When returning to normal routine, patients should take slow and gradual steps. Trying to do too much too soon may delay the recovery process. Depending on the severity of the injury, some patients need extensive long-term therapy to regain mobility and relearn basic skills, so it is important for the patient to be proactive and follow the doctor's recommendations. The acceptance of a permanent condition may be difficult for some patients. Family will be needed. Patients also need to recognize and be aware of any new or worsening condition, as this can indicate serious complications. In situations like these, patients are advised to seek immediate medical attention. Now, to check for understanding, here is a quiz. The wife of a 45-year-old patient with a gunshot wound to the head is asking the nurse why the doctors are wasting time ordering scans and not beginning surgery on her husband. When explaining to the wife which of the following scans would the nurse indicate is required prior to the surgery. I'll give you guys some time to look over the answers. If you picked B, you are correct. Hope you guys enjoyed our presentation, and thanks for watching.